Hi, good afternoon, everybody. This is Dr. Ken Muich, Fibromyalgia Wellness Center, Stetson Chiropractic Clinic. This is number 116 live video on fibromyalgia and other related health subjects. Today we're going to be talking about the arthridities and how and if they are affected by fibromyalgia or the other way around. What are the arthridities? A lot of people have asked. They are various forms of arthritis that the people actually get one way or another. We're going to be talking about it. Usually they involve osteoarthritis, rheumatoid arthritis, psoriatic arthritis, and a little bit more rare one, but I have come across quite a few times in my 30 plus years, polymyalgia rheumatica, believe it or not. You know, there's a lot of things that affect the arthritis or arthridities, and it also affects fibromyalgia and many other conditions. And our world today is sort of in fire between the COVID-19, the obvious unrest because of the, all I think I can say is the killing of an individual by police in Minneapolis. I watched all 10 minutes and I was just shocked at what was going on. And also the unknown factor, what is our future going to look like? COVID-19 was bad enough. Now we have all these other things that are going on and any of the other stresses and strains that you are being affected by, which affects your condition, which actually makes your condition and the symptoms worse. So we're going to take a look today at arthritis and its many factors. You know, it's interesting. Fibromyalgia is, believe it or not, was given the, the position of being an arthridities. Fibromyalgia it's not anywhere near anything close to fibromyalgia. However, almost all of the symptoms of those things that I named off, osteoarthritis, rheumatoid arthritis, psoriatic arthritis, polymyalgia rheumatica, have very, very similar symptoms when it comes to central nervous system and also the musculoskeletal system. Things such as, obviously, pain, stiffness, loss of range of motion, flexibility, tenderness, swelling of the joints, fatigue, the lack of sleep or reduction of sleep because of pain, of course, reduced physical function in itself, inflammation, depression, all of these things are the same as fibromyalgia, believe it or not. Now, so how do you differentiate these? Well, I'm going to try and work with these and explain to you how you can actually help differentiate. Keep in mind, as I mentioned from the beginning, if you have fibromyalgia, it makes everything else worse. So if you already have an osteoarthritic condition or an arthritis, shall we say, chances are very good that you will have an increase in symptoms in all of those areas that I had mentioned. The pain and stiffness and swelling and loss of range of motion and loss of functional ability, a loss of activities of daily living. You can't, you're stiff and sore and achy, fatigue, depression. Okay. Somebody asked, what do you think about the curfew laws? Well, hopefully it'll get you more rest, or maybe you'll have a chance to relax and read a little bit more concerning the curfew laws itself. But anyway, somebody just sent a question in, to me. So let's take a look at osteoarthritis itself. As I mentioned to you, all of those symptoms I mentioned to you already that are the arthridities that I had mentioned are the same things that you have with fibromyalgia. Now, there's a lot of other symptoms with fibromyalgia. They go on and on. Hair loss and urogenitary problems and a variety of different things that you can have. But at least those are very, very similar. To be honest with you, when you think about it, a lot of those are the same things that you have with fibromyalgia. Like I said, it's not all of the symptoms, but it can get very frustrating for you to understand exactly which ones go where. And so that's why it's very, very important to understand. Now, osteoarthritis is the most common form of arthritis that we have. It affects millions of people. It wears down the cartilage over a period of time. Caused by what? Well, it could be age, it could be injuries, obesity. Females have a higher level of osteoarthritis than males, initially at least. And there was study that done. Most people after the age of 40 start to get some form of arthritic condition, where you have the pain in the joints and so forth. Some of the things that popping and cracking and so forth of the joints. You actually have also bone spurs that form and evolve. There are osteophytes and syndesmophytes. Those are medical terms. Most people know them as bone spurs. That's the easiest thing to really remember and understand. And oftentimes people come in and say, what is this? They'll have some swelling in certain joints of the body and so forth. Now, if you look at the hand, from that part up in the hand, and actually that part of the thumb itself, vast majority of the time osteoarthritis. This part here, base of the thumb and the wrist, is usually rheumatoid, oftentimes psoriatic itself, but rheumatoid is very, very common in itself, and that's the most important thing. So I want you to understand, osteoarthritis, you can't reverse it, you can't change it in any way or form, for the most part, except for one area, I'll explain in a moment, but you can reduce the pain and inflammation. How? Well, the easiest way for a lot of people is just take, some form of medication and so forth, but that's just temporary. Keep in mind, every time you take a medication, you have secondary side effects, all right? But the diet of yours has very, very important aspects that can reduce inflammation. I've told people, stay off of sugar, gluten, trans fatty acids, and dairy. They're all known to have inflammatory reactions that can cause problems in your joints. Now, I've showed you the hands because that's very, very important, but you can get it in the shoulders, you can get it in the spine, you can get it in the hips, knees, ankles, toes, you name it. Oftentimes, old injuries show up in osteoarthritic conditions. Believe me, after playing about 12 years of football and thinking you're indestructible, a couple of accidents that I had, so forth and so on, I'm definitely feeling the side effects of those, but I keep on stretching, moving, doing things like this, activities. And that's important because one of the things about osteoarthritis is that motion will actually, obviously you can be stiff and sore and achy in the morning, but motion really helps you get past this in many respects, where actually the cartilage itself starts to produce oil, which allows the joints to move freely, which actually then will make you feel a little bit better when you're active. That is different from rheumatoid arthritis, the RA aspect. It's a destructive, chronic immune system condition. Your immune system overreacts and it starts attacking your good joints in itself. It's destructive, and you can really have a lot of problems with rheumatoid arthritis where it becomes disfiguring, especially in the hands and joints, as I mentioned to you. You have a lot of swelling factors. Oftentimes for rheumatoid arthritis are genetic. 60% of the time they're genetic. So if some members of your family have had rheumatoid arthritis, not trying to scare you or anything, but you might want to check into that, and we'll get into it in just a few minutes. What is brought on by this also can be smoking, poor diet, the environment, a little bit of everything can be actually very, very important. So, but your immune system is the thing where the body overproduces what's called TNF alpha, which is a protein that actually goes into the joints and causes an inflammatory reaction itself. Now, the next thing would be psoriatic arthritis, and that's very, very interesting. That is also destructive. It's an immune a moderated aspect also, where your immune system overreacts and causes inflammation and damage to the joints. You have a variety of different areas, just like rheumatoid arthritis. The rheumatoid arthritis can be in the knees, the shoulders, the wrists, the fingers, so forth and so on. Same thing with psoriatic arthritis, low back pain. You can have reduced range of motion, all of the symptoms that we had talked about before, which are very, very important because those are the things that actually you want to look for. But what are the different things that actually can differentiate psoriatic from rheumatoid? Well, some of the most important things for this is that you have some blood tests that are important. For both RA and psoriatic, you have what are called blood tests, which would be C-reactive protein, and also an ESR, erythrocyte sedimentation rate, for inflammation and pain. X-rays are extremely important for osteoarthritis because it can differentiate. See, osteoarthritis adds additional those bone spurs, whereas rheumatoid and psoriatic arthritis can actually destroy the ends of bones itself. You literally look like somebody's eaten the ends of your bones away in the joints. Very, very destructive. Psoriatic arthritis you can also find with skin lesions and conjunctivitis, which is different from a lot of the other areas or the other arthridities that we're talking about. So, rheumatoid arthritis and psoriatic arthritis are immune system overreactions where your body actually is causing its own effects on your joints itself, where it destroys the cartilage in the bones and causes inflammation and all those other symptoms that we talked about. One of the best ways, again, to diagnose rheumatoid arthritis and psoriatic arthritis are those that I mentioned, a blood test, but also x-rays, very, very important, and because they actually will show the joint destruction itself. And psoriatic, and you've seen it on TV. How many ads have you seen on TV for either Xeljanz or what's the other one? Let's see, Xeljanz or, got to look it up here just for a second myself. My apologies. Humira, okay? Humira, Xeljanz, and many other ones are out in the medical field for your symptoms and reduction of those. But make sure you look at the side effects again. You don't want to have any additional side effects that don't match. Since there's other medications, what is they say? You can see more of me, okay? Well, because especially the psoriatic, where you have all these lesions and so forth on your arms and different parts of your body and your legs. Get rid of them. That's great. Allow you to live a much happier, healthier life in itself. Just check on the side effects. Make sure you understand what that is. So the polymyalgia rheumatica, that's very, very interesting. Polymyalgia rheumatica, very, very interesting. Again, the tests that you can have are the same ones that we talked about, the blood tests, the ESR, erythrocyte sedimentation rate itself, 3 times more popular in females than it is in males, believe it or not. As I said, usually after the age of 65, well, believe it or not, in my 30-plus years, I think I've had about a half a dozen that I've actually diagnosed, and I'll explain to you how very, very quickly. But almost every one of them were under the age of 65. I would say between 45 and 55 were my patients. Can come on very, very quickly, and all of a sudden you have pain in both shoulders, both elbows, both wrists, both knees, both hips. You can go get x-rays. Looks a little bit osteoarthritic, no RA, no psoriatic damage to the joints and so forth, but you have this ongoing pain in both joints, like I say, the shoulders or the elbows or the wrists, the knees, the hips. And that's one of the ways that you can help diagnose that by having a bilateral joint pain with really negative symptomatic results. But the nice thing about this, whereas osteoarthritis, you can reduce the pain, but once you get spurs, you can't really get rid of them. And I'll explain to you, there is one that they can do. Rheumatoid arthritis and psoriatic arthritis, again, once you get it, you have it. But polymyalgia rheumatica, and I'm not crazy about giving out medication and so forth, but prednisone is a killer of this polymyalgia rheumatica. About 15 milligrams, and I've had patients literally within a week, bingo, they're gone. Now, a lot of the medication or a lot of the studies you'll hear is that polymyalgia rheumatica, you should be on this medication for at least a year, so forth and so on. Sometimes this reacts so fast that the symptoms are gone. And the proper doctors will tell you, look, if it starts coming back, we'll put you back on again. So it's one of those things that I think personally that if your symptoms are gone, and again, I check with these patients, once it's gone, oftentimes it stays. If it does come back, just get on a prednisone for a short period of time, and the symptoms go away, bingo. That would be the best way, I think, to manage and control this. So you have to understand that if it's bilateral, both hips, both joints, shoulders, whatever, that's differentiating you from many of the other arthridities that might be just one hand or one knee and so forth versus the other. So I hope you understand both osteoarthritis and polymyalgia are more female destructive, shall we say, more common in females. Rheumatoid arthritis, psoriatic arthritis are destructive, and it's your immune system overreacting to what's going on, and it gets into the bones and cartilage and so forth. And then you have bone destruction itself. It's destructive to the point where you can actually see it on X-rays in many stages itself. So, whereas osteoarthritis itself is not destructive, polymyalgia rheumatica is not destructive. That makes a big difference as far as not only diagnosing, but also what you can or cannot do yourself in itself. Oh, I was talking about osteoarthritis. You'll get these nodules on your joints and your fingers. And I've had patients go in, and some doctors will do it, and they'll actually burr off that extra spur, so to speak. And the patients just love it. So you might want to check with your doctor if you have these joint spurs, so to speak, that stick out, and see if they have the capabilities to go in and literally burrs off the edges of those extra joints in itself, or the extra spurs that form on the joints that oftentimes do not allow you to move your hands properly. Well, I hope I gave you proper information on this. Try to get as much rest. Try maybe turn the TV off and not be stressed out. Protect yourself from COVID-19. It's not over with, but for fibromyalgia patients that are maybe not as active as most people, probably you are in some respects a safer aspect than those people that are actually out and celebrating, so to speak. They think everything is over with. I just heard there's been, I think, an 11% increase in symptoms since a lot of people are out partying, shall we say. So let's hope and pray that we keep this under control, that you have less stress, and hopefully I gave you some information that will actually help differentiate fibromyalgia from these others. Or you can have both of them. It's just that fibro is making worse, and so you have these flare-ups in itself. Look forward to seeing you next week and talk about another subject concerning those areas and conditions I mentioned to you that have common symptoms with fibromyalgia. And oftentimes you may have RA, you may have psoriatic, you may have osteoarthritis, you may have polymyalgia rheumatica, and not even know about it, and you're blaming everything on fibromyalgia. Whereas there may be some answers for you with medications or some other things. And keep in mind, all of these are inflammatory. What did I say? You can control a lot of this by reducing sugar, gluten, trans fatty acids, and dairy in your diet. Okay? Just try it. Try it for a couple of weeks and see what happens. I can't tell you how many patients that I've worked with will come back literally and say, man, I can't believe that those foods were actually adversely affecting you. Thank you so very much. Dr. Ken Muich, Fibromyalgia Wellness Center, Stetson Chiropractic Clinic. Need to get in touch with me? Please check the Facebook, YouTube, information on there. If you want to email me, I'll give you my email, D as in dog, C as in cat, Ken, K-E-N. The number 2000, that's 2000 at C as in cat, S as in Sam.com. One more time, D-C Ken 2000 at CS.com. Have a wonderful week. Look forward to seeing you next week. Tell your family, friends, anybody might have fibromyalgia, you're interested in information on fibromyalgia and other related health subjects, join us. Thank you very, very much. Have a great time. This will be saved, and check YouTube for all the other ones. Fibro Wellness Center. Look forward to seeing you next week at 12:30 p.m. Monday. Bye-bye. Oh, yes. And make sure that when you have a chance to look up some of these things, hopefully you will, that you look at the various ways that various medical facilities look at these in a variety of different ways. I think you'll find that it's very, very interesting. But all of this information I gave you really is from research itself. Thank you very, very much. Have a great day, great week. Bye-bye.